हमारे चेयरमैन और एडिटर इन चीफ इंडिया टुडे ग्रुप को श्री अरुण पुरी जी प्लीज आए।
Honorable Health Minister Dr. Harshvardhan and all our viewers out there, welcome to the 6th edition of the India Today Safaigiri Summit and Awards. It is an honor and a privilege to have hosted these awards since 2014, when Prime Minister Narendra Modi nominated the India Today group and me as Swachh Bharat ambassadors. As you can see, in our new Corona world, we are holding this event virtually. We were not going to let the virus get us down. We must all live in hope and not fear. As you all know, the world has been battling the Corona pandemic for most of this year. This is the most severe health crisis the world has faced in recent history. Globally, there have been over 34 million confirmed cases of COVID-19, and more than 1 million people have died. Today is the 192nd day since India implemented a nationwide lockdown to check the spread of the virus. So far, India has recorded more than 6.3 million cases of COVID-19 and 98,000 deaths. We rank second to America in the number of cases in a country. The good news is that our recovery rate continues to rise and is now at 83.5%. To India's credit, it has a much lower case fatality rate as compared to other countries. Today is a milestone day as we have reimagined the goal of the Swachh Bharat mission. Coping with COVID-19 challenge remains a daunting task. This is why this year we're calling the Safaigiri Awards the Healthgiri Awards. Given the state of our healthcare systems before the pandemic struck, these achievements need to be lauded. Despite severe setbacks, personal and professional, through a series of lockdowns and other restraints, these men and women have enthused themselves and others to initiate, innovate, energize, and work for the welfare of society at large. We all witnessed the heartbreaking sight of thousands of urban migrant workers struggling to go back to their villages with their family and meager belongings. Many of our countrymen and women rose to the occasion to alleviate their suffering. India fought for Jaan and Jahan. Hospitals, private and public, rose to the challenge within days of initiating the coordinated national response. National institutions prepared and revised the protocols for diagnostics and testing. State-owned entities, conscious of the ever-changing ground realities, ferried medicines, ventilators, and other equipment across the country swiftly. Enterprising companies developed indigenous testing kits and medical equipment and a fraction of the cost of the imported ones. Non-governmental organizations devoted themselves to uniting people by offering a slew of services, from providing rations to the needy to making masks and sanitizers. None of these remarkable people and institutions knew that they would be recognized for their work while they were doing it. I am delighted that we are awarding their selfless work. May I also add that India Today has contributed for battling this pandemic, both by influencing thought and through actual action. The Care Today Fund has distributed essential rations and medicines when they were most needed and where they were, and our reporters distributed along with their reporting duties. We are also deeply honored that Prime Minister Narendra Modi has sent the India Today group a special message for our initiative, which you will see shortly. Thank you, Mr. Prime Minister, for your encouraging words. Yet, as we all know, the pandemic is still amidst us, even as we celebrate these contributions. The government and our vast healthcare network will have to be alive to the continually changing ground realities and rework their strategies to combat the virus. Across the world, the efficacy of dealing with the pandemic has depended on three factors. First, the quality of governance of the state, which includes the condition of the country's health services and the seriousness with which the government has taken the pandemic. You can see how governments across the globe have reacted to the crisis with varying results. Second is the strength of the economy. How much money does the government have to spend on health care and on relief for those suffering because of the pandemic? The lockdowns and the risk of infection have damaged many businesses and livelihoods. A strong economy is the foundation of a strong country. The third is the behavior of civil society. How disciplined are they in following government guidelines to avoid the spread of the virus? How willing are people to help others? India has challenges on all these three fronts. The country has made great strides in improving its health infrastructure in a very compressed time frame, but it has made us realize how deficient our healthcare system is. We need to spend much more on it. The economy was in trouble even before the pandemic, and COVID-19 has set it back further. Although there are some signs of revival, but we have a lot of catching up to do, even to get back to where we were. Perhaps it's a good time for audacious reforms. Civil society, by and large, has risen to the occasion on following the government's guidelines and also is helping the disadvantaged. Awareness of the danger of COVID-19 is high, but there are constraints because of the cramped living conditions for large sections of our population. We all know that the Modi government is the most hard-working government we have ever had and is working on all fronts to overcome all the challenges COVID-19 has posed. No one knows this better than the Honorable Health Minister, Dr. Harshvardhan, who has been at the forefront of the battle to combat COVID-19 in the country. Dr. Vardhan is a health professional in his own right, a medical postgraduate from the Ganesh Shankar Vidyarthi Memorial Medical College of Kanpur. He represents Chandni Chowk in Delhi as a member of Parliament. Coincidentally, he was elected chairperson of the Executive Board of the World Health Organization in May this year. As a minister, he has been hands-on while tackling the COVID challenge. Apart from formulating and executing policy, he has often made a first-hand appraisal of the facilities at hospitals and other health utilities. He's been urging citizens that health and cleanliness go together and to scrupulously follow guidelines for self-protection and checking the contagion. Dr. Vardhan, we have chosen the winners of Healthgiri Awards through an online nominations. This has been backed by a survey and a select jury comprising of Mrs. Anu Aga, a former member of the Rajya Sabha, Mr. Manish Sabharwal, Chairman, Team Lease Services Limited, Dr. Srinath Reddy, President, Public Health Foundation of India, Dr. Devi Shetty, Chairman, Narayana Health, Dr. Naresh Trehan, Chairman and Managing Director of Medanta, Dr. Gagandeep Kang, Vaccine Expert, Dr. Swati Piramal, Vice Chairperson Piramal Group, and myself. I want to thank them for having taken the time out to do this. we received an overwhelming response of more than 1,000 nominations from across the country. 5 or 6 names were shortlisted for each of the 11 categories. The winners were selected by the jury and verified by an independent research agency, MDRA. I believe that the winners today, as well as those who participated in the Healthgiri Awards, are the true heroes and the real champions of New India. It is our privilege to recognize their outstanding work. Thank you.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.